Hello everyone, welcome back to my channel. In this video, let's see the Winters classification and the PELL Gregory classification. So what is Winters classification? In this we see the inclination of impacted third molar to the long axis of the second molar. So in this we have to understand one in order to understand all of the rest. So in this there are 6 types, that is mesioangular, distoangular, horizontal, vertical, inverted and transverse. Let's understand mesioangular first. So in Winters classification, what do? We see the inclination of impacted molar to long axis of the second molar. Let's read this. What is mesioangular? It is the long axis of the third molar bisects the long axis of second molar above the occlusal plane. So let's see it in diagram. If this is my ramus of mandible, this is my second molar and this is my third molar. This is second molar and this is third molar. Now the inclination of third molar, that is the long axis of the third molar and the long axis of the second molar, these bisect at this point. And this point is higher or above the occlusal plane of the teeth. So this is my occlusal plane. This is my first molar. This is my second molar. This is my premolar. So this is my occlusal plane, and this bisecting point of the long axis of the third molar and a second molar is above the occlusal plane. This is mesioangular. So this tooth is angulated in such a way that it is towards the second molar, and it is this bisecting point is above the occlusal plane. So this was mesioangular. In the same way, distoangular, it is the long axis of third molar is away from the long axis of second molar at the level of occlusal plane. In mesioangular, the interradicular bone, that is the bone between the second and the third molar, is more, and this tooth is easier to remove, whereas distoangular is the most difficult extraction. So this is a question. The most difficult extraction is distoangular tooth, and in this the interradicular bone is less between the second and the third molar. So first is mesioangular, second is distoangular, third is horizontal, that is the long axis of the third molar is at 90 degree to the long axis of the second molar. This is horizontal. Whereas in vertical, the long axis of the third molar will be parallel to the long axis of the second molar. That is, both will be in same direction in vertical. So both will be in same direction, and the interradicular bone will be normal. The interradicular bone between these two teeth will be normal. Then inverted impaction, and the last one is transverse impaction. In transverse impaction, the tooth is completely impacted. So Winters classification, 6 types: mesioangular, distoangular, horizontal, vertical, inverted and transverse. Now let's move on to PELL Gregory classification. In this we will be seeing 2 things. First, we will be seeing relation of tooth with adjacent tooth and ramus. So in this, one thing has to be kept very clear. While seeing the relation of tooth with adjacent tooth and ramus, we will be using the word class. So class 1, class 2 and class 3. Whereas when we see the depth of third molar in the bone, that is, we are seeing how deep the impacted tooth is in the bone, in that case we will be using the word position. So position A, position B and position C. Let's see each and every one in detail. So first we will be seeing relation of impacted third molar to the anterior border of ramus of mandible and the second molar. So we are seeing what is the space available on the second molar. Let's see. So in class 1, let's see the definition. There is sufficient space available between the anterior border of anterior ramus and the distal side of second molar. So what are the things we are talking about? This is the anterior border of ramus. I'm not drawing the full ramus. So this is the anterior border of ramus. This is my second molar. So this will be my distal side of second molar. So we are talking about the space present here between the anterior border of ramus, ascending ramus, and the distal side of the second molar. So this is the space we are talking about. So class 1 says that there is sufficient space available. So this is my second molar, this is my third molar. So what does this mean? That this mesiodistal width will be equal to this mesiodistal width. There is sufficient width, there is sufficient space available for this third molar to come out. So that is class 1. So that means the anterior-posterior diameter of tooth is equal to the space between the anterior border of ramus and the distal side of the second molar. In this diagram, I have drawn the second molar in green and the impactor tooth in red. So there is sufficient space available. Now let's see the class 2. What is class 2? That is the space available between the anterior border of ramus. This is the anterior border of ramus and this is the second molar, and the space available here for the tooth to erupt is less than the mesiodistal width of the crown. So the space required was this much. That is, this much space was required for the tooth to come out, but the space present is very less. So small amount of bone covers the distal side of the tooth. So class 1 was that there was sufficient space present, but in class 2 there is less space present, and in class 3 there is absolute lack of space. So let's revise. In this PELL and Gregory classification, we did the relation of impacted teeth to the anterior border of ramus of mandible and the second molar. In class 1, there is sufficient space available for this impacted molar to come out. In class 2, there is lesser space available, and in class 3, there is absolute lack of space. The tooth cannot come out. So basically this position, that the ramus is here and there is absolute no position for no space for this third molar to come out. That would be class 3. Now let's see on depending on the anterior bone covering the impactor tooth and the relation to the occlusal plane. So in this, what we will be seeing, we will simplify it. First let's read. So in this, in green I've shown the normal the tooth which is present. So this is the second molar, this is the first molar, and in red I've shown the impactor tooth. So in what is position A? The highest point of impactor tooth is at the level of adjacent tooth. So this was the highest point of impactor tooth, and this is the ascending ramus. So this ascending ramus is covering this part, and only this portion of tooth is seen in the oral cavity. So this highest point of the impactor tooth is at the level of the occlusal plane of the oral cavity. So this is the occlusal plane and this is at the level. So what is position A? This highest point of impactor tooth is at the level of adjacent tooth. What is position B? In this, let's see the diagram first. This is the impactor tooth. In red I've shown the impactor tooth. This is the second molar. This is the first molar. So this impactor tooth, this is the highest point, for example. So this is at a level which is below the occlusal plane. This is the occlusal plane of the second molar and the first molar. And the highest point of this impactor tooth is at a point which is at lower level than the second molar. But this highest point is above the cervical line. This is the cervical line of the second molar. So the highest point of this impactor tooth is at a lower level than occlusal plane, but at a higher level than the cervical line of the second molar. So let's read this. The highest position or the occlusal plane of impacted tooth is below the occlusal plane. So this is below the occlusal plane but above the cervical line of the second molar. Then position C. Position C is that the impacted tooth is below the cervical line of the second molar. That is, it is even below. In position C, the tooth will be present here. That the highest point will be below the cervical line. So let's revise this also. So position A will be that the highest point is at the level of the adjacent tooth. Position B will be the highest point of this impacted tooth is below the occlusal plane but above the cervical line, and position C will be that the impacted tooth is below the cervical line. Hope you found this video helpful. If you found this video helpful, do like and subscribe to my channel. Thank you.